let's start diving into COVID-19. So, COVID has cast a global spotlight on vaccinations and their importance, but many countries have gaps in their readiness for deploying this vaccine, whether it's a lack of workers properly trained for vaccine distribution or improper vaccine safety systems or data gathering systems. What gaps have you dealt with in previous campaigns that you've worked on, and how did you overcome those?
So COVID-19, I absolutely agree. It's taken a different turn, not just to the programs, but also in various aspects of our life. But it's also really, I think it's also as you said, there is a spotlight on immunization and vaccines program. So it's really a good opportunity for us to kind of also really capitalize on this to kind of build up on the existing EPI program that we've been working so hard over the years. So I think just to give you a concrete example in terms of what happened, as I said, that we'd work on a strategic document, the National Deployment Vaccination Plan. And we kind of really, it was really put together as a collaborative effort, and it was really put fast and we were able to publish this document in November last year for countries to kind of really develop the strategies and the plans. And it was really, really successful because more than 100 countries use this framework to kind of build up on their plans. But it did not stop there, right? So we did kind of, once the plans were kind of put together by the countries, we did develop the team at WHO headquarters and partners. We kind of developed a process called the regional review process, where a committee was set up in the regions, and they were validating the plans that was coming out of the country. So and so all of this was analyzed at a certain point when all the plans were put together, and just in the I'm just going to share the reports from the analysis. And in terms of the plans that the countries were developing, that we saw that there was some of the issues around the gaps in costing and funding was one of the major ones. But there was also some kind of gaps identified in surveillance and in vaccine safety. These were some of the gaps that were identified over an analysis of all the NDVPs that the countries had kind of put together. And also there was a further analysis, more of a deep dive done by the Gates team to kind of see what came out of the plans out of the country. So there were that aspects, but moving forward, there's a lot of evolving moving pieces in terms of trying to resolve all of those gaps and those situations that countries have identified. And there's a lot of resource materials that have been developed over time after the NDVPs were published in November. So we have country-specific guidance on cold chains or data and monitoring, on surveillance, and on costings, some tools to kind of help countries build their just to work on the gaps. And also this is an evolving area of work. So we are constantly working towards developing this strategic document so that the regions and the countries, we try to give them a holistic picture of what are the updates that are happening on a regular basis with the COVAX, and that will eventually be helpful for the implementation of the COVID vaccines rollout. So yes, there was the plan, and then there is a review process, and then there is also moving pieces towards filling those gaps. Yeah.
When we're talking about countries or regions preparing for one of these vaccine campaigns, what tends to be the biggest hurdle? Is it financing or vaccine hesitancy, or maybe the workforce or something else?
Yeah, I think this is a good question, but in terms of really, I think some of the bigger hurdles, like you did mention, and I do agree that these are some of the hurdles, but I think the biggest hurdle, while I have been working with different countries for setting up campaigns, is really having the having this sort of high level political commitment, right, in the country. I mean, uh, just at the national level, this is an important part to get the high level political commitment. So I see that there is a lacking or an insufficiently high level political commitment. So I feel is the big one. And in terms of other, it's more on the resources, and I will say it's mainly focused on the operational cost. And I certainly feel that even in the COVID vaccines, we've seen that with the funding and the costing, it's all about countries, they are being supported with the COVID vaccines, but not so with the operational cost. And that's really a big challenge with the implementation. And this is not a very different in a campaign setting also. So I feel there is really the lack in terms of operational resources and at the national level, and by the time, even if there is support going out to the countries, by the time it trickles down to the local lower level, it's really late, so these are some of the issues I feel is a big one. But also there are other issues like vaccines not being delivered on time, so that countries can have can deploy the vaccines to the primary healthcare center or even lower levels. So just the vaccination deployment is untimely for the campaigns. And also in terms of all of this, it does sum up to that there is also a late preparation of activities like drawing a roadmap, drawing the micro plan. So this is sometimes it really it kind of creates a hollow in terms of when you don't have a good micro plan, you don't have the clear job definitions for who's supposed to be doing what. So all of this is a big one. But lately, I felt that we are really working towards integration of. We are really, I mean, we've been doing the campaign tracking for disruptions with the COVID-19 with the COVID-19 pandemic, right? And we've seen there's a certain level of disruptions, but we're also tracking the reinstating, how the campaigns are being reinstated over time. And we are finding that there is a certain level of appetite for integration of multi-antigen campaigns, and that's also actually happening, right? So with the work that we want to push forward with the integration, there is really this in the countries also there's this really vertical disease approach, and each focal point is really kind of moving, looking at their specific antigen. So I feel that sometimes when you want to really plan a good integrated campaign right at the start, just the vertical disease approach is sometimes kind of a hindrance. And so you might have to look at things from a horizontal approach. So that's also one of the issues we're facing with kind of getting countries to do more of this multi-antigen integrated approach of the campaigns.